Welcome students. This is part 2 of the series of histamine and antihistamines. So, let's start with the role of histamine in allergy and anaphylaxis. The symptoms occur from injection of histamine are similar to anaphylactic shock and allergic reaction symptoms. They result from the release of chemical like histamine, but there are some other chemical mediators like serotonin, leukotrienes, eosinophil, chemotactic factor. It is thought that the difference between these two situations, that is allergy and anaphylaxis, they result from the difference in the sites from which mediators are released or maybe in their release rate. That's why they are producing two different situations, i.e. allergy and anaphylaxis. Now a question may arise in your mind. How the histamine is going to produce the specific situation, either allergy or either anaphylactic shock? The answer is simple. If the release of histamine is slow enough to permit its inactivation before it enters the bloodstream, there will be a local allergic reaction occur. But, if the release of histamine is fast enough to permit its inactivation, there will be a full-blown anaphylactic shock occurs. Now, we are going to start with antihistamines, in which firstly, we will talk about H1 antihistamines. H1 antihistamines are primarily refers to H1 receptor blockers. In this H1 antihistamines we also classify type of generation of drugs. There are two types of generation of drugs as mentioned in Pharmacology by Lippincott. So, starting with first-generation drugs. First-generation drugs are still widely used because they are effective and inexpensive. Also, mostly drugs penetrate CNS and causes sedative effect. They also interact with other receptors, produces many unwanted adverse effects. Now, let's talk about second-generation drugs. Second-generation drugs are specific for peripheral H1 receptors. They don't penetrate to BBB, blood-brain barrier, and they are modified in such a way that they are being added carboxyl group and make them polar. Let's consider an example of cetrazine. Cetrazine is actually a carboxylate derivative of hydroxyzine. These agents don't penetrate to blood-brain barrier because of the carboxylation, and they causes less CNS depression as compared to the first-generation drugs. The examples of second-generation drugs are cetirizine, levocetrazine, ceslorotidine, fexofenadine, loratadine. In these examples, first two drugs are partially sedative and the rest three drugs produces least sedative effect. Now, let's talk about the effect of H1 antihistamines on different receptors. When H1 antihistamine acting on cholinergic receptor, there will be increased dry mouth, increased urinary retention, increased sinus tachycardia. The example of H1 antihistamines acting on cholinergic receptors: diphenhydramine, promethazine. Now the effect H1 antihistamine when acting on alpha-adrenergic receptor. So, there will be increased hypotension, increased dizziness, increased reflex tachycardia. Promethazine is the example of H1 antihistamines for alpha-adrenergic receptors. Now, when H1 antihistamine acting on serotonin receptor, it will increase the appetite stimulation. And cyproheptadine is the example of H1 antihistamines for serotonin receptor. Now, when H1 antihistamine acting on histamine receptor, So, it will decrease allergic inflammation, itching, sneezing, and rhinorrhea. It will also decrease neurotransmission, increase sedation, decrease cognitive and psychomotor performance, and it will increase appetite. The example is all H1 antihistamine drugs. Now, let's talk about the multiple effect of H1 antihistamine. Let's consider the example of cyproheptadine. Cyproheptadine is also act as serotonin antagonist, means that it is going to stimulate appetite. Another is azolastine and ketotifen. It also produces mast cell stabilizing effect. Now, let's talk about the therapeutic uses of antihistamines. So, number 1 is allergic and inflammatory conditions. Antihistamines are useful in treating allergic and inflammatory conditions which are caused by the antigen acting on the immunoglobulin E antibody. The example is oral antihistamine. Oral antihistamines control allergic rhinitis, urticaria, etc. Another example is ophthalmic antihistamine. They control allergic conjunctivitis. In ophthalmic antihistamines, the drug includes aralopatidine, ketotifen, azolastine, alcaftidine, bepatastine, amidastine. There is very important note to consider. H1 receptor blocker are not indicated in treating bronchial asthma because histamine is the only one of mediators that are responsible for causing bronchial reactions. Epinephrine has an action on smooth muscle that are exactly opposite to histamine. So it acts on beta-2 receptors on smooth muscle and causes CAMP-mediated relaxation. Therefore we can say that epinephrine is the drug of choice in creating systemic anaphylaxis and other conditions that involve massive release of histamine. And another is because of their lower potential to induce drowsiness, we can consider loratadine and fexofenadine may good for the people working in jobs where wakefulness is critical. Number 2 is motion sickness and nausea. H1 antihistamine along with antimuscarinic agent, scopolamine, so they are going to do prevention from motion sickness and they also prevent nausea and vomiting. The drug meclizine are used to treat vertigo which are associated with vestibular disorders. The examples are diphenhydramine, dimenhydrinate, cyclazine, meclizine, promethazine. The third one is insomnia. Insomnia is a condition that can make it hard to fall asleep. Many first-generation drugs like diphenhydramine, doxylamine have strong sedative properties, hence they are used to treat insomnia.